This is Dr. Robin Murphy. I'm a naturopathic doctor and I work at Conceive Health. So thank you everybody today for joining us. I think it's a really exciting topic around fertility nutrient panel. So today I'm going to talk about what the heck is a fertility nutrient panel, how does this impact our fertility, how do we know what the appropriate dosage, forms of vitamins, duration is, and how this affects fertility overall. So whether you're in the stages of planning a pregnancy, maybe you've tried and haven't been successful yet, or maybe you're actually working with a fertility clinic, I think this information can be really helpful for all of you ladies out there and couples, because it's not just men, it's not just women, I should say, that it's important for nutritional health. It's also important for your man too. So 50%, remember 50% of the DNA is coming from the sperm. And there's a ton of nutrients that can be really supportive, that has shown to be helpful for sperm quality, sperm motility, and kind of improving some of those semen parameters and outcomes. So we are taking questions today too, so feel free to put your questions in the comment section. And I have an excellent moderator today, Katie, so she's going to be helping me out just to make sure that I don't miss any questions. And if we happen to miss them, then we're happy to, just send us a quick email and we're happy to maybe address that. I also have, sorry for the run-on sentence, but I also have opportunities if you have questions or you're kind of unsure about coming into the clinic. We also have 10-minute introductory calls with myself and the other doctors. So let's get started. So first of all, what the heck is a fertility nutrient panel? So this would be a typical string of labs that would be done. This is serum labs, so a blood test that's done. So you would get a requisition from the clinic. We would test things like vitamin D, vitamin B12, ferritin levels. We would look at your CBC. We also look at other vitamins like vitamin A and Beta-Carotene, which aren't normally run. We also look at fasting glucose as well as fasting insulin, and then cholesterol levels. And there's a few other labs that are a little bit more obscure that I'll run, such as uric acid. This can be an indirect marker for oxidative stress and DNA damage. So this is kind of the laundry list, and I'm going to go through each of these to explain a little bit about their impact on fertility and why they're important. But before I do that, a very common question is, why isn't this typically run at my doctor's office or part of a fertility basic workup? And I think the short answer of this is, when you go to your fertility clinic, they're looking for specific parameters that they have expertise in. And so their medical training is obviously with lifestyle, some dietary recommendations, but a lot of pharmaceuticals. And so there are certain vitamins like vitamin D and iron that they will definitely check, look for anemia, and can prescribe those nutrients. But some of the other nutrients, it's not so commonly prescribed by your medical doctor. And so this is where naturopathic doctors really thrive. And we have, in our medical training, naturopathic medical training of 4 years, we have 4 years of nutrition, nutraceuticals, botanical medicine, including labs and interpretations. So we are really a special, specialist when you come to this area, and really, I would say the best profession to come to when it comes to looking at these sort of parameters. So when it comes to these particular labs, I think most of you guys are familiar with vitamin D. So I'm going to talk about some of these vitamins and lab markers in isolation. So vitamin D, this is actually a hormone. So the hormone, it gets made in our skin when the sun stimulates, and this will transmute or stimulate the conversion of vitamin D, pre-vitamin D, into the active form through a number of different pathways. And so it's important for calcium absorption. So this is, important for bone health. It's also important for our immune system, as well as hormones. So vitamin D is actually a nuclear receptor as well. So this will help all of our hormones, not all of them, but a lot of the hormones to properly function and bind to the receptors. So that we find that it can affect estrogen levels, mood, and like I said, some of these nutrient absorptions as well. So vitamin D, very easy to check both for males and females. An interesting study found that for women with PCOS, if you get your vitamin D levels a little bit higher, so 95 to 115 nanomoles per liter, then there was an 83% reduction in risk for miscarriage. So this is important. It's a very simple parameter, and just getting your vitamin D levels up may help reduce the risk of pregnancy loss early on. Then when it comes to iron, so iron is extremely important for delivering oxygen through our blood. So it helps to produce hemoglobin and bind the oxygen, just so that we get energy throughout the entire system. Low iron is described typically as iron deficiency anemia. You'll notice symptoms like fatigue, shortness of breath. Maybe with exercise, you'll notice a little bit less endurance capacity. If it's very severe, you'll notice, bluing of the lips even, tachycardia or rapid heart, and just feeling exhausted. So women who are definitely, are at risk are those who have a lot of heavy bleeding during their periods. Also, we have to remember that if you are restricting iron in your diet, so you're not eating a lot of animal-based proteins, which are more easily absorbed for the body, such as in vegans or vegetarians, they'll be more at risk for deficiency. As well, if you're suffering from a lot of gut symptoms, so chronic gut disruption, IBS, gastritis, Crohn's, any sort of IBD, if you've had a chronic infection, all of these will influence your iron levels. So I'll look at ferritin. I'll also look at the complete blood count, so CBC, and I'll look at certain parameters to see what is the variation in the size of the red blood cells. So that'll tell me if there's a microcytic or macrocytic anemia. So that can help to determine whether it's an iron deficiency or something like B12 or B6 or folate deficiency. So that brings me to B12. So B12, extremely important, not only for DNA synthesis and for your red blood cells, but it's also important for energy, for your brain, mood. It's also part of a pathway called methylation. I won't get too technical, but essentially this pathway is providing vitamins for hundreds of biochemical pathways. So this can be a really good starting place for patients. If you're feeling kind of generalized symptoms like low energy, low mood, you're noticing that you're not recovering as quickly after exercise, just feeling kind of blah. And maybe a lot of people are feeling that way these days. Looking at your nutrient levels, particularly B12, getting that up can be a really easy way for us to kind of address some of these. And, this is obviously important. Methylation is something that helps to recycle a certain amino acid called homocysteine. So if homocysteine is too high, then this is actually detrimental to pregnancy. So higher levels can increase risk for pregnancy loss. It's very inflammatory. Long term, it increases risk for things like cardiovascular disease, and it's actually used as a direct marker. So beta-carotene and vitamin A. So can you guys think of where beta-carotene comes from? So beta-carotene is that orange pigment found in lots of fruits and vegetables, some green vegetables as well. So beta-carotene, it's rich in things like carrots, beets, sweet peppers or red and yellow peppers. And beta-carotene is important itself as an antioxidant. So it helps to kind of sop up any of the reactive oxygen species. These are the components that can damage the cell membrane. And this is what's really important in fertility and preconception care, is making sure that our balance between antioxidants and pro-oxidants are in balance. So beta-carotene, it's an antioxidant, and it also is important for getting converted into vitamin A. So vitamin A is similar to vitamin D, an actual retinol or nuclear factor. So a nuclear factor, essentially this vitamin gets into the cell, it goes into the nucleus, so the inner area within the cell where all the DNA is, and this binds to a particular part of the DNA, and that will turn on hundreds and hundreds of genes. So vitamin A is absolutely essential for those initial stages of rapid cell turnover during embryogenesis and during that early fetal development. You know, you think of this little cell that then duplicates, rapidly over the first 5 days, and then, up to 12 weeks just to create this little human. And so every time that cell divides, you're actually replicating the DNA, and you need the genes to be turned on and off appropriately. And this is where vitamin A comes in. So there's a lot of studies showing too little of vitamin A as well as too much of vitamin A can be, impactful to a healthy pregnancy. So it's really important. A lot of supplements and a lot of practitioners will completely avoid vitamin A, and I don't recommend practitioners prescribing unless they feel comfortable. But there are low levels of vitamin A that can be prescribed under the care of a practitioner if your levels are low. And this would be important, especially kind of the 3 months, or I would say 6 months before you're even thinking of conceiving. And often what I'll do is look at things like fish oil or cod liver oil that has a little bit of active A. And what's interesting with beta-carotene and vitamin A, and I'll get into this a little bit later, is there's actually genetic changes that can make certain individuals prone to vitamin A deficiency. So even though your intake levels of beta-carotene are good and you should be able to convert it into retinol, your body isn't as efficient. So in that case, you would need more animal sources or kind of preformed vitamin A in supplemental form. So it's important to see what those levels are and get kind of a snapshot. When we look at cholesterol levels, we'll look at all different types of cholesterol. So LDL cholesterol, HDL, triglyceride levels. And this is really telling us a lot about your liver, about metabolic health, inflammation, even some hormone imbalances. So say, for example, you have low thyroid. This is where we can see elevations in in cholesterol. So when we talk about cholesterol in general, the cholesterol is important. As I said, it's kind of a metabolic marker. So when we see that cholesterol is high, it's not that we just want to, take something or, a supplement or a drug to just lower that cholesterol. We will definitely look at certain lifestyle factors. So we'll look at diet, and we'll look at specific ratios of protein and different fats and healthy fats, including omegas and polyunsaturated fatty acids. And then we'll look at insulin levels. We'll look at blood sugar, as well as different types of macronutrients of carbohydrates. As well, we'll look at inflammation. So all of those factors that I mentioned that can contribute to high cholesterol, we'll take a deeper dive on. So it's really a biomarker to help us understand some of these other underlying factors which can affect your body's health and cholesterol levels, and then also just addressing fertility. When it comes to fasting glucose and insulin, so these two together help to give us a certain calculation. So the calculation is called Heme Iron. So it looks at your kind of score for insulin resistance. And you can think of insulin resistance kind of like you're knocking at the door, but the door isn't being answered. So if you're, this analogy is that the hormone is kind of knocking at the door of the cell and it's binding to the receptor, the insulin receptor, and it's, saying, hey, let me in. We have a job to do. We need to get the blood sugar down. We need to get the blood sugar or the glucose into the cell. And this is energy for your cell. So the more insulin resistant you become, then what we find is that this process of not, getting enough energy to the cell becomes compromised. We can see changes with metabolic output, so the amount of energy being produced by the cell. You'll get into something called anaerobic metabolism, and this can cause the body to produce more lactic acid and just, more soreness, less tolerance to endurance type training. And then it definitely can affect things like cravings. So cravings for particular foods, more high carb, high sugar type of foods. So this would be quick energy that the body is easily able to digest and then spike the blood sugar and spike the insulin. So when you're looking at the Heme Iron or you're looking for signs of insulin resistance, it's very common, particularly in women with PCO. This is kind of one of the characteristics that we see. And for women who have fluctuations of insulin resistance or insulin and blood sugar, we find that it can lead to anovulation or a lack of ovulation. And this is one of the key components. If you're not ovulating, it's very difficult to get pregnant. And so this is, it can be helpful to understand is, what is the reason that you're not ovulating? Is the insulin having an impact? Or does it have to do with other hormones? In addition, the insulin is actually driving the testosterone and androgen production. So this can also aggravate the symptoms of PCO because a lot of these symptoms are characterized by high testosterone or high androgen. Sometimes we'll see DHEA high or testosterone or androstenedione or all three. So it helps us to kind of understand a little bit about, are we treating this more of the insulin that's causing the drive in testosterone, or is it other signaling? So just as a recap, so the insulin and glucose, cholesterol, Beta-Carotene, vitamin A, vitamin B12, iron, vitamin D, all of these are part of kind of a fertility nutrient panel. And this is a great way to start, your fertility journey, get a baseline, see where your levels are at. And I mentioned before how some individuals may have genetic predispositions. So what's really interesting and what we're starting to see is that the recommended daily allowance or recommended daily intake of some of these nutrients, this was proposed based on a general population study. And what they did is they took a group of individuals deemed healthy, and they looked at their kind of levels for their blood levels for each of those vitamins and determined what was the dietary amounts that they needed to prevent deficiency. So when you look at some of these, offhand, I think vitamin D is, don't quote me if I'm wrong here, but vitamin D is very low. I think it was like 80 IUs per day. 8 milligrams of iron per day for men and women. And it seems very low. And what wasn't taken into account is individual variance. So as I mentioned, there's certain diseases, gastrointestinal diseases, gastritis, celiac disease, inflammatory bowel disease. If you've been diagnosed with many chronic diseases, they'll have additional nutrient requirements. Any chronic inflammation, we'll see it with chronic pain to even autoimmunity. We'll see a lot of changes in nutrient requirements. If you're taking any medication, this is really important because a lot of these medications can deplete some of these vitamins. So for example, birth control can deplete vitamin B6. I didn't talk about that because we don't normally test it in the blood, but we often look for symptoms and signs of B6 deficiency. So taking medications, having any diseases, specific dietary restrictions. So I mentioned vegans, vegetarians, and I'm not, I don't have a hate on or anything like that. It's just being mindful. If there's any restrictions within the diet, even if it's keto, even if it's, high protein, low carb, no grain, all of these are eliminating certain sources of other nutrients. So vegans and vegetarians in particular, any animal-based vitamin there's going to be a higher risk for deficiency. So omega-3 fatty acids, vitamin A, vitamin D, vitamin E, vitamin K. I think I got them all the fat-soluble vitamins. So there's going to be a much higher risk for deficiency along with protein deficiency. And then when it comes to other factors that influence inter-individual variability is genetic predispositions. So when we look at this type of genetics, it's called lifestyle genetics. And so it's looking at certain genes that will impact the enzymes or the transporters or other protein carriers or factors that are important for the normal metabolism, transport, and absorption of a lot of these vitamins. And what we see is there are a huge amount of variability in the efficiency that people have in absorbing nutrients, transporting, and their requirements. And so this can be a really helpful way of looking at what is your individual need. And we'll use genetic testing. We could use, in addition to past medical history and lab tests, to get a good kind of baseline and understanding of exactly what your needs are. And that gives us kind of this individualized approach. So it's not this kind of blanketed panacea of nutrients. Everybody gets, a milligram of folic acid. You really want to know what type of vitamin as well as the dose and then the duration. And so all of these factors will have a huge impact. And when it comes to folic acid, so folic acid is the synthetic form. Well, up to 10% of the population has a 90% reduction in how efficient they're able to convert that folic acid into the active form, or what we call as the bioavailable form. So this bioavailability is how your body actually uses this vitamin. So if you can't make it into something that is active, then it kind of just floats around in your blood, or it stays within the cell, and it doesn't impact the body, or it's not utilized the way that we like to. So folic acid, most people know, is important to prevent neural tube defect. Now, there is a very low rate of neural tube defect now that folic acid has been fortified into many foods. And it's just kind of common practice that you'll take a folic acid with a prenatal. And I would say it's important, just as a slight modification in order to look at the type of folate. So is it folic acid, or are you taking methylfolate? So that can be the more active form. And as I mentioned, some of those people with genetic predispositions, it may be better for them to use this form than the other. So we have one question. So if I take a B complex, do I also need to take B12? So that's a great question. You have to look at the B complex, and you have to look at the amount of B12 within that B complex. So I've seen some really good dosages in B complex. It depends on the brand. It depends on the company. And so the company itself make sure to look at the label. And the dosages vary. It could be, I've seen as low as 1 microgram, so a thousandth of a milligram, up to 1 milligram, so 1,000 times more. And like I said, the amount that you're looking for each day depends on a few different variables. So you would look at, what are your blood levels of B12? Are there any markers or signs that you could be B12 deficient, even if the blood levels are the same? And then is there any gastrointestinal issues? What's your dietary intake like? So for some, I do recommend a B complex plus a B12, and it kind of tops them up. It gives them the extra B12 that they need that they may not find in a B vitamin or B complex itself. And it's a good point. I think I've also seen the opposite, where people will just take folic acid or they'll just take B12. But we have to remember that all of these vitamins are working together. So they always have what's called cofactors. You know, it's not that folic acid just creates DNA on its own and that's it. It's using a lot of other minerals and vitamins in order to make sure that process is completed. And so if you take a really high dose of just one nutrient, what can happen is there's something that's called collateral pathway deficiency. So what that is that you're actually depleting more nutrients if you're not increasing them with the other vitamins that you're taking. So you're ramping up the pathway, but not supporting all of the other friends that go along with it. And so it's important to take, vitamins in appropriate dosages as well as combinations. And then I think this brings me to a really good point of the form. So I talked about whether it's bioavailable or not. So a lot of these vitamins will come in different forms, and we know that they are more absorbable and usable by the body in certain forms. So for example, iron, you can get iron as a oxalate, so that's typically not very absorbable. There could be a ferric acid. This is more of the ionized iron. And then there's iron bisglycinate, for example. So this is the iron is bound to different molecules, and those molecules will be absorbed differently. There's also heme iron, so that typically comes from animal source, so that will be much more absorbable than, say, the ferric iron or the ionized iron that comes more from plant sources. So it's really important to look at the dose, look at the form of it, and know if is it more usable, is it more absorbable, is it more tolerant. So some of the different forms will also depend on what you're able to tolerate. So the iron is a good example. Some people don't tolerate the heme very well, and a bisglycinate may be better tolerated. And then when we look at the professional or the company that's providing the brand, so not all brands are created equally. In our clinic, we use professional brands. So professional brands, they typically do come with a little bit of a higher price tag. And what you're paying for is they do third-party testing. So they make sure that the raw ingredients that come in from the distributor is actually what they say. And you would be surprised. So I used to work for a supplement company as the clinical advisor, and I got to go to the facility, and there's these huge tubs of just raw materials. And what the lab will do is they'll take samples and they'll actually test each of those products to make sure that whatever the ingredient says that it is the actual ingredient. And so there has been cases where, it'll be an animal byproduct or it'll be filler instead of the ingredient that was ordered. So one, they'll test the raw ingredients, and then two, they'll also test the actual dosages in the final product to make sure that what they say on the label is actually, in fact, what they're delivering. And then making sure there's no contaminants, there's no, it's free of heavy metals, of fillers. Some companies will use fillers, but you want to make sure that filler is actually, won't compromise your health or be detrimental, or some people react to some of those fillers. And those are really important factors to think about as well. So I think I've gone through everything. So is there any other questions that you guys have? I feel like I've been talking a lot and I hope you guys have been following along and, finding some useful and valuable information within our talk today. The next steps, I would say, if you're thinking about fertility, if you've kind of been on the road to fertility, it's really great to just get a baseline, whether you go to your medical doctor, you go to, come to the Conceive Health and get a baseline and an initial assessment. Essentially what we'll do is we'll look at your reproductive history. We'll look at some baseline labs. We'll go through your full past medical history, see what not only reproductive health, but other, systems could be impacting your health. Because fertility is kind of like a barometer for other things going on. As I mentioned, there can be nutrient deficiencies. We can also see hormone imbalances. And we can see other genetic predispositions that all impact your fertility and where you're at. And when it comes to, specific things like looking at egg quality, look at if you're going through IVF and you're doing egg retrievals and you're looking for increasing the number or the quality of those eggs, then a lot of times, there's not a pharmaceutical necessarily that's shown to help increase, let's say, egg quality. A lot of that has to do with mitochondrial health. So the mitochondria is a little, I call it the power plant of the cell, and it's what's producing all of the energy for that cell. And as I mentioned, there's this high amount of cellular divide and replication in the early stages of embryogenesis, as well as with ovulation. You need to make sure that the genes and the genetics are healthy in order to make sure that you're sustaining that early pregnancy. So a lot of times if there's a history of early pregnancy loss or chemical pregnancies, then this can be because of poor egg quality, even poor sperm quality. And so what we would be focusing on is supporting the mitochondria. So we would give certain nutrients like L-carnitine, CoQ10, NAC, ALA. There's a lot of different resources that we would use, and it would be important. They're different for men and women. So it's important to kind of work with a practitioner in order to make sure that the dose is appropriate, how it's taken is appropriate, and then the form, like I said. And then when it comes to, I just have another question here. So Michelle, iron, how it affects gut health in periods. So it's the opposite. So your gut health and your period can affect your iron levels. So if women have a history of heavy periods, and I typically define this as more than 150 milliliters of blood within your menstruation. Now, it's not like we're measuring this, but typically you could find that if you're changing your pad or tampon, more than every hour or 2 hours, or you're bleeding through at night, then this could be a sign of heavy bleeding. So typically if there's a lot of heavy bleeding, there's going to be blood loss each month. So that's really going to drain your iron stores, and you'll see an increased risk for iron deficiency. And then for gut health. So gut health, this is one of my favorite topics. We've done a Instagram Live before on the microbiome and fertility. So there's some really fascinating research and, treatment options that we can address with different testing and analyses. So make sure to check that out in the Instagram Live. But from a nutrient standpoint, gut health has a huge implication on not just iron, but many different nutrients. So the absorption of those nutrients depend on the health of our digestive system. So how well can we absorb it? If we have a malabsorption issue, so we have celiac disease, if there's been chronic infections that have destroyed the microvilli of the gastrointestinal lining, that can have huge implications on nutrient absorption. And then finally, the last one is the medications that you're taking, particularly proton pump inhibitors, so acid blockers. So acid blockers, it can reduce some of the absorption of certain minerals in particular, so zinc and calcium. And that, if people are on those long term, then that can lead to chronic deficiency, mineral deficiency. And I mentioned other medications and the microbiome. So the type of bacteria. So the microbiome is this balance of healthy bacteria as well as maybe not so healthy, so pathogenic bacteria or opportunistic bacteria. And the microbiome, it's really fascinating. It's this symbiotic relationship where the bacteria are actually helping with certain metabolic functions. So it's helping with the absorption and production of certain vitamins, like vitamin K2 comes from our digestive system. The B vitamins are important. They also produce certain vitamins called short chain fatty acids. So this is really important for our lining of our digestive system. And it's also important because anything coming in from the digestive system goes through the liver, and the liver is what is metabolizing a lot of our hormones. So we will see this connection where the digestive health, if it is off and there's byproducts of bacteria, you can think of them like bacterial toxins. They're coming into the liver, it's causing inflammation. Then we're seeing hormonal imbalances. And so this is, what I describe as a systems biology approach or an integrative approach, where we're not just looking at your reproductive organs, we're looking at your digestive health, your liver, your capacity to be able to metabolize and eliminate hormones appropriately, stress levels as well, and hormone balance. It's not uncommon to think, or it's intuitive. We all know that everything is connected. All the systems are in one body. But often what I see is we kind of look at these symptoms in isolation. And so this is very much what I will work with patients coming into the clinic. And that's why our initial is an hour long. So we go through all of these systems and potential contributors to your fertility, but health overall. So that was kind of a long-winded, as fertility, that's really also a barometer for your own health. And what's interesting with men is that sperm count and sperm parameters can actually be used as, it was thought to be used as a marker for longevity and risk for cardiovascular disease. So many of the factors that will influence the health of the sperm, like cholesterol levels, oxidative stress, nutrient levels, levels of homocysteine, I mentioned the B vitamins and recycling of homocysteine, all of these impact fertility, but long term, they also impact cardiovascular health. So it's really no surprise that sperm parameters and sperm quality is kind of a predictor of some of these downstream lifestyle chronic diseases that can pop up down the road. Okay, so if you guys have any questions, just type them in right now. It's it's such an interesting field to be in, and I'll tell you a little bit about kind of my practice and how I some of my background, how I ended up here. And I started my practice very much in women's health, but really got into gut health. And I started a company with a dear friend of mine who is a nutritionist, that was called the IBS Academy. And so we focused our whole entire business and practice on supporting individuals with chronic digestive complaints. And over the years, I've also worked as a scientific advisor for a genetics company. So working on how to develop some of these genetic tests and how individualized dosing really depends on some of these genetic variables. And then, it's kind of come full circle where all of this is starting to be combined into one whole picture to focus on fertility. When it comes to FSH, so there's a question here, are there natural ways to decrease FSH? So FSH is follicle stimulating hormone, and essentially this is a hormone that is a signal. It's getting released from the pituitary gland in the brain. So when the hypothalamus produces gonadotropin releasing hormone, then that stimulates follicle stimulating hormone. And this is what's responsible for developing and maturing the follicles within the ovary as well as within the testes. And so a marker of health can be those levels of FSH as well as LH and their ratios. And you can think of as the sensitivity to FSH or the response to FSH lessens, the brain will kind of send out more signals and say, hey, are you listening? Produce more follicles, and the follicle levels will go up. So there's a few different reasons why FSH could be high. It could be high because there's a sensitization issue. So the follicles aren't binding to the receptor appropriately, similar to insulin resistance that I was talking to previously. And there could be that there is less follicle production. And so the feedback mechanisms and signaling to the brain aren't being developed appropriately, so the levels keep rising. And there are some herbs that can be really helpful in helping to lower FSH, as well as some of these insulin sensitiving or sensitizing supplements or treatment recommendations. So often I'll use things like inositol. I'll also look at the stress response as well. So sometimes bringing down, that stress response, or what's called the HPA axis, help regulate the feedback mechanisms. That can be helpful. Improving the follicle maturation and egg quality, can be helpful. And then helping to reduce, some of these herbs that can be helpful for hormone balance. So with that, it's definitely, important on an individual basis to make those assessments rather than kind of this panacea approach. So we're coming into, 45 minutes. I think that's all I have to say for today. So I really appreciate you guys joining and sticking around and listening to everything about fertility and nutrient panels. Some of the individual nuances that we see related to dosing, requirements, and what can really be helpful. And consider getting some of these baseline nutrients tested during your, preconception and nutrient journey or fertility journey. This can be a really, a good way to start to figure out, are there mild adjustments that need to be made prior that are relatively easy to fix. So we can do that through diet as well as supplementation. And then what I would suggest is, come to the clinic, check out the website, www.conceivehealth.com. You're welcome to book an introductory call. And especially if women, I have a question, kind of women over 45 are planning to get pregnant. So if you're going through any sort of IVF, you have frozen embryos from before, or you're doing egg retrievals, which will be frozen or fresh. There's lots of protocols that we use from a nutrient standpoint, as well as acupuncture during that process that can be helpful just to ensure egg quality, help with things like implantation, blood flow, oxidative balance. There's a lot that can be, supportive and reviewed and considered in your treatment plan. So thanks again, everyone, for joining, and I look forward to speaking with you, hopefully, and enjoy the rest of your evening. Take care.